Cancer doesn't just attack the body, it can erode joy, purpose, and the will to keep going. Roughly 1 in 4 US adults with cancer meets the criteria for clinical depression, a rate several times higher than what's seen in the general public. Depression amplifies pain, erodes treatment adherence, and shortens survival. Standard antidepressants can take 6 weeks to work, interact with chemotherapy, and help only about 1/3 of patients. But now, researchers have discovered a powerful new approach that could change everything. A groundbreaking Phase 2 study led by Dr. Manish Agrawal of Sunstone Therapies has found that a single 25 mg capsule of psilocybin, when paired with talk therapy, can significantly ease the emotional burden that often accompanies cancer. The trial enrolled 28 adults who had both cancer and major depressive disorder. Each participant completed several preparatory therapy sessions before receiving the single psilocybin dose in a closely monitored room with trained guides. The results were remarkable. 2 years later, over half of participants, 53.6%, still showed clinically meaningful reduction in depression. Half of all participants had achieved full remission by that time. Anxiety also eased for 42.9% of patients. The drug works by activating the serotonin 5-HT2A receptor, temporarily loosening rigid thought loops and allowing therapy to reshape outlook. Animal imaging work hints that psilocybin increases proteins linked to new neural connections within hours. Participants often described their sessions as emotionally intense, but many said it helped them reframe their diagnosis and feel more connected to loved ones and life itself. Some reported a sense of peace that persisted long after the psychedelic effects wore off. Unlike daily antidepressants, psilocybin works in a single session and doesn't require long-term use. Its effects emerge quickly. Mood improvement can begin within 1 day, far faster than typical SSRIs, which can take weeks. The Food and Drug Administration granted breakthrough therapy status in 2024 to a similar psilocybin compound, accelerating regulatory review. If positive findings continue, cancer centers may eventually offer a brief psilocybin session instead of months of pills. This study, published in the journal Cancer, offers new hope for the millions facing both cancer and depression, proving that sometimes one dose can make all the difference. For more on this story, find a link to the full article on Earth.com in the description.